Hello and welcome back to Resilience Unraveled. And a really important subject tonight. One of the things I worry about possibly most is ever having an eye operation or anything go wrong with my eyes. And tonight we're joined by Dr. Pam Theriot, who's coming to talk to us all about all sorts of stuff to do with eye health, dry eyes, screen time. All I can say is I am looking forward to it very much. And that's a terrible pun, but first of all, welcome, Pam. How are you?
Great. Thanks so much for having me.
Great.
Appreciate it.
And where in the world are you? I can detect an accent there.
Oh, well, I live in Louisiana in the US, and I've been here for about 9 years.
Oh, where were you before?
Well, my husband's in the US military, or he was. He's retired recently. And so we moved around a whole bunch in the 20 years that he served.
Very nice too. So a military wife.
Yes, yes,
Yes.
it really molds you being a military wife. You have to be a strong person to go through it for 20 years. So.
Hmm. Okay, brilliant. Well, look, tell us a bit about yourself and what it is that you do.
Right. So I have been an eye doctor for almost 24 years, and I've really put a lot of time and passion into developing my understanding and my interest in dry eye disease because we are spending so many more hours a day on our digital devices. It is
Hmm.
becoming much more widely known as a problem across all age ranges. Used to be more of women in their postmenopausal years had dry eye, but now there is a wide variety of people who are suffering from eye dryness because of our screen time.
Okay, that's interesting. Now, I'm going to ask you a really obvious question. So forgive me, but for those who may not know, what is dry eyes?
So dry eye is not having the right composition of tears on the front surface of your eyes. There are three parts to tears, and so many people don't understand that there's a watery layer. Most people just think it's watery, but then there's a mucus layer that holds the water on, and an oily layer that coats the the tears in general, and keeps them from evaporating out into the world.
And what are the tears doing?
So they're bringing nutrients to the front surface of your eye and making your vision clear. So if you don't have a smooth tear film over your eyes, then the light that's coming into your eye is immediately scattered and blurred, and you don't see clearly.
Okay. So I'm guessing, and I may be wrong here, but I have to ask this question. Is there a difference between the tears which are in your eyes, like in a static way, generally, and the tears that run down your eye, run down your face when you're crying? Is it the same thing?
No, no. So you're
Ah,
absolutely right. There's a homeostatic tear or tears that we produce all day long to coat the front surface of our eye. And then there's emotional tears that are going to have a different composition when we're sad or joyful. And then there's the reactive tears. If you were to poke yourself in the eye, right, then
yeah.
your eye floods to get rid of that irritant. So all sorts of different kinds of tears.
So do your tears affect your eyesight? I mean, is there a difference or a correlation between long-sighted, short-sightedness and tears, or is that irrelevant?
No, not necessarily being farsighted and nearsighted, but the blurriness or the crispness of your vision, tears do affect.
Okay. So I'm guessing, and I might be wrong here, but I do enjoy a good guess. So I'm guessing that the way we generate this homeostasis in our eyes is by blinking, but I might be wrong because I know everybody does that. I'm watching you doing it actually.
Right. So yeah, there's a feedback of, you're looking at something and the signal from the front surface of your eye goes, "Hey, I'm feeling dry." It sends a signal to the brain, make some tears, blink the eyes, and then we blink, we refresh that oily layer each time we blink and coats the tears again. The problem that we're having now is that with us staring at digital devices, it cuts that blink rate to a third of what we're normally doing. If you and I were sitting in front of each other, actually having a conversation, we would blink more than we do looking at each other on the monitor.
Is that right? Seriously? I
So
mean,
true.
and you're saying by a third almost.
Yes, yeah. 21 times a minute is normal blink rate, but when we're on digital devices, it drops to about 7 times a minute.
What? Why is that?
It has to do with the attention that we're putting on the screen
Right.
and our attention going to the screen and we're concentrating. You've seen a 10-year-old playing a game and they're just like wide-eyed, they've got their eyes as open as possible and they're trying to get it and they're getting really excited, and so you just don't blink as often.
And so when you're not blinking, so what's actually happening in the eye?
So the tear film is drying out into the atmosphere, number one. But over a long term of us not blinking properly or at regular intervals, the oils that are inside our eyelids and the glands in our lids will start to harden. And as they harden, it's harder for you to blink and get them out onto the front surface of your eye, and then the gland atrophies. So, not because of you working long hours yesterday, but from decades and decades of us being on these devices, the glands will atrophy and you don't have the same glands that you did 20, 30 years ago.
Wow. Is there an advantage or a disadvantage to tears or dry eye through wearing glasses or having contact lenses?
So, wearing glasses wouldn't affect it significantly. Contact lenses, however, are now something else inside the eye that'll split your tears so that you'll have half as many tears up against your eye and half as many in front of the contact lens. So contacts can make your eyes feel more dry.
Nice. So that explains the fact that my better half every morning squirts stuff into her eyes because she's post. I better not say that. Well, she's of an age where she's been told her eyes are drying out, and this is actually what's happening. She has to put some sort of gunk in twice a day.
Yeah, so she's hydrating her eyes with an artificial tear, I'm
Yeah.
assuming, just
So
giving herself more moisture. Yeah.
yeah, that's right. So okay then. So basically, by anything that involves, and I know what you mean by that thing when I've been concentrating on something like writing a document or something, there's actually you notice when you blink, don't you? You really do.
If you haven't blinked for a while, then doing it maybe, oh, yeah, now I feel refreshed.
Yeah, oh, that's absolutely fascinating. So it's basically having your eyes out in the air too much that creates dry eye. Simple as that.
Exactly.
So
Yeah,
it's
our
so there's a
eyes.
really simple remedy, which is to blink more.
That is definitely one of them, like taking some time to blink when you're on a digital device and you know that, you've been concentrating for a while, then actually taking the time to blink will benefit you.
So in what way does it affect eye health generally?
Digital devices or the lack
No,
of
the lack of
blinking.
tears, yeah.
So then we don't have our body's natural defenses at their full contingency, right? If your tear film is deficient, then you're more susceptible to infection.
Really?
The dryness can actually break down the front surface of your eye. So there's little dry spots on your eye. So, yeah, it breaks down your defenses, and of long term, it can cause scarring to the front surface of the eye if left unchecked.
Wow. Is there a way, I mean, as I said earlier, I'm really neurotic about my eyes. Is there a way that generally are there things we should be doing generally to help our health to protect about the fact that we are on screens all the time? So should we have a different sort of regime? I'm interested as well about what we might eat or have dietary wise that might affect our eyes.
So you're exactly right. There are some steps that we can take on a daily basis to protect ourselves. Just like we stand in front of the sink and brush our teeth every day to
Yeah,
take care of them and preserve them, there are simple steps that we could take to preserve the health of our eyes.
right.
And the one of the best ways is actually to clean your eyelids and lashes every day with a lid cleanser, and that gets rid of dirt, dust, and debris that might bring inflammation to the front surface of the eyes. Just like plaque on our teeth could give us gingivitis if not removed, that could lead to an infection. Same with the eyes. Cleansing them on the daily basis is one of the most important things we could do to keep our eyes healthy.
So I'm thinking if you wear makeup, that must be a more of a problem, is it?
Absolutely. And people who don't remove their makeup at the end of the day is just places for bacteria to make your eyes and eyelashes home and flourish. So yeah, cleanliness is super important.
So if we wanted to dry or clean our eyes at the end of the night, there's those sort of like wipes, or there's I'm only thinking about the bathroom shelf at the moment. There's all sorts of these bottles, micellar water or whatever, and pads and things. Is there a cleaning regime that you would recommend?
Absolutely. So you mentioned micellar water is an eye makeup remover, right? That's generally very gentle on the skin, good for sensitive skin and eyes. So making sure that we remove our eye makeup completely. And then there's a lot of readily available cleansing pads that have a soap on them that's gentle enough to use in the eye area. And then you would scrub with the iPad and then make sure to rinse it away. Is great to do every evening. That way you're cleansing the day of dirt, dust, debris, pollen away from your eyes,
Yeah.
and then having a fresh start.
And for those that don't wear makeup, I mean, there's quite a lot of people that don't. Again, are you recommending this sort of cleaning regime as well?
Oh, absolutely. So those just using those soapy pads or using a cleansing spray. There's also foaming cleansers that are available. And I
Is
know
it?
you mentioned, yeah,
Go on,
you
sorry.
were you were talking about foods that we could eat
Oh, yes.
for our eye health. In particular, when we're talking about that oily layer that comes from our eyelids, omega-3 fatty acids are very important to supplement to have a boost that layer.
Yeah,
And so fatty fishes, walnuts, or even taking an omega-3 supplement.
really. So I'm wondering, putting aside screens, generally is this something that's got worse over time because of, say, the difference in environment?
So I think the main thing of why this is more prevalent in 2025 than it was in 1985 is due to our screen time. It's due to
Okay.
how many hours a day that we're spending on our devices. Because 20 years ago, as I said earlier, dry eye patients were 40-year-old and up females, and men in general didn't have dryness, and especially kids didn't. But today we can find teenagers that are suffering from dry eye,
Really?
because kids today, they're born with a cell phone in their hands, right?
Yeah. Well,
They're
I blame the parents
entertained.
personally, but there you go. But we used to read. We used to have this thing that was called it was like a book, and it
Book.
had this paper that, sorry, I just fell over my footstool. It had paper, and you used to turn it back as but was there a different sort of focus to that?
There absolutely is. So there have definitely been studies saying what is your blink rate when you're reading a paper book
Okay.
versus, say, a Kindle. It could be the exact same book, and you will blink more often when you're turning the pages than when you're on the Kindle.
Really? Oh, that's really
Mm-hmm.
interesting. I didn't know that about the Kindle because everybody sort of bangs on about how wonderful Kindles are, don't they? And but that's the same problem. Interesting. Wow. Is there anything else we should know about our eyes? Anything else we should be thinking about?
Well, absolutely. Along with cleansing your eyes and taking a nutritional supplement, you can also heat your eyelids on a regular basis. If you've spent a long day on the computer, having a warm compressed mask to put over your eyes can be very soothing, and that helps to melt the oils in those oil glands and allow them to come out onto the front surface of your eyes.
So I'm guessing if
Or
we did something like a sauna or a steam room, would that similar sort of effect happen, or would it be would the negative effect of the heat on the eye be compensated by the heat and you're actually within the eye? That might be a problem, mightn't it?
I wonder, the sauna might be okay because it's a moist heat that you're surrounded by, but
Yeah.
the heat onto the glands with a warm compressed mask is what you're after to melt the clogged oil in the oil glands.
So I know you've written a book,
Yes.
what was it called? Yeah, I know you're going to tell me, and I know you're going to probably wave a copy in front of my face again, but remind me.
It's called Alleviate Dry Eye.
Now, I wonder what that's about.
So I wrote the book for patients who maybe were struggling with dry eye as a way that they could walk themselves through. It's an 8-week program where you look at why your eyes are dry. Is it because you're staring at a computer screen? Is it because you're going through menopause? Or is it because you're taking an antihistamine for your allergies every day and you don't
Oh,
realize that's decreasing your tear production?
right. Oh, so that's So that's a sort of a side effect of something else.
Right. So there are many medications that we take, like blood pressure medication,
Really?
birth control pills, even anti for pain. Those medications can decrease our tear production. And I've got a whole list in the book of different medications that can affect it.
Wow. I suppose we have to be careful and not terrify people when we're talking about this. Or should we?
No, absolutely. I mean, dry eye is treatable. And again, that's why I wrote the book, because once you know what's causing it, then you can get into what you do to make it better. In the book, there's a chapter on sleep, on eye makeup, contact lenses, and then your environment, what you can do. If what if your work is to stare at a computer screen for 8 hours
Yeah.
a day? Well, you could add a small humidifier next to your computer so that you are getting that moisture into the air, like you're talking about with a sauna. So you're getting more moisture into the air around you. You can set up your computer screen so that you're at the right distance from your computer and not getting additional eye strain.
Now, it's interesting you talk about that because I tend not to notice having dry eyes when I use the computer.
Mm-hmm.
That doesn't mean I don't. It just means I haven't noticed it. But I tell you where I do notice it is when I'm driving the car, and it may well be that the air comes on, and perhaps there's like a flow of air maybe in your face, and I particularly notice that. Is that again another environment that's tricky that's not screens?
Exactly. Plus, depending on the time of day that you're driving, you may be more vigilant about what you're looking at. So, like driving at night, and you don't want to miss your turn. And so you have
Yeah.
that wide eyed, non blinking, or it's raining and you got the windshield wipers. And so you're white knuckling the steering wheel and really focusing on what you're doing. And those two, but it's probably either the air conditioner or the heater blowing directly at you,
Yeah.
that's drying out the air in the car in general.
And would the fact that you have dry eyes make you feel more tired? Because that often, and I mean, that might be a correlation, not causation type thing, but because we often feel tired in cars, don't we? And I'm wondering if it is because our eyes are drying out. I mean, that's a reach, but
No, but that's definitely a symptom of dryness, is that they feel tired, they feel
yeah,
heavy, weighted down.
yeah, it's interesting. So it's called Alleviate Dry Eye, and I noticed you can buy it on Amazon. It's got a fantastic rating score. We don't see that sort of score very often. Pam, that's amazing.
Thank you.
Congratulations. How else can people find out more about you?
Well, I recently did a TEDx talk.
Oh,
So
very
that's
good.
available on YouTube. And my website is my name, Pam Theriot, spelled theriot.com, where I have a ton of free resources and product recommendations, a blog, and some courses if you are suffering from dry eye that you can, again, have some coaching through what you can do to make your eyes better.
I'm just looking at, thank you for saying the riots. That really does help understand spell the name. And I noticed you've got the archetypal picture on your website, which is the picture of a woman who's got a face covered in white stuff and a cucumber on their eyes. Is that an urban legend? Is that an urban myth or is that a thing?
So cucumbers do reduce swelling. And so there's a lot of inflammation involved with dry eye that it ends up driving inflammation on the front surface of the eye. So things that can reduce swelling are very helpful to the treatment of dry eye.
Absolutely fascinating. I had no idea there was so much in this subject. Right. So basically, you can buy the book, you can go online, you can take a quiz. I do enjoy a
Mm-hmm.
quiz. And are you selling products as well, or is it mostly sort of coaching?
So I do make product recommendations, absolutely, and some you can find those on my website as well.
And you run a course as well, I see.
Yes.
Very good. Okay, brilliant. And are you on all the socials if people want to see what the work you're doing out there?
Absolutely. Instagram, Facebook, TikTok, YouTube, and LinkedIn. You can find me at Pam Terrio or Pam.Terrio on all the socials.
Or the riot, which is even
The
better. I
Riot.
noticed you haven't mentioned what we used to fondly call Twitter. You're not on that.
I'm not on X, no.
Strange that, isn't it? I wonder
I
what
don't
happened
know.
to X, eh?
I don't know. I never jumped on that bandwagon.
Well, look, it's been an absolute joy to meet you, and I really enjoyed that. And I think what's fascinating is a very, very complicated, complex subject, actually. But the sort of remedies are relatively straightforward. Is it just about taking some time and care and effort, isn't it? At the most simple level.
Right. The same effort that you would put into taking care of your teeth every
Yeah.
day, you can put into your eyes. And I do want to let your listeners have something special. So if they went to my website at pamtheriot.com/resilience, I'm going to have a downloadable handout for them so they can dive
Okay.
into the information.
That's very kind. Well, it's been an
Thank
absolute
you.
joy. Thank you, Dr. Palmer. It's been well, I hope you have a brilliant day. And I think it's highly amusing that you produced a book which is online, so we can all sit and get dry eyes, reading the book, and then take all your advice and get ourselves back to being fantastic again. I am being mildly amusing, but not very, so I apologize.
No, it's available in paperback too. So,
Ah, thank goodness for me. For the old-fashioned soats. Well, look, thanks for spending
yes.
time with us there. I really do appreciate it.
Thanks for having me.
You take care.